Several years ago, CYBEX made a decision to develop a new type of testing and rehabilitation system, a system that doctors and clinicians would recognize as essential to their practice and their patients. It had to be affordable, compact enough to fit any size facility. It had to reduce the time needed to set up a patient, have an easy-to-use software package, and efficiently access patient information. We've asked a few physical therapists to join us for a private introduction of our new system. Well, I see everyone is here. Why don't we get started? I'm Allison Cartwright, responsible for marketing and research at CYBEX, and this is Tom Essex, our design engineer. Before we introduce CYBEX's new testing and rehabilitation system, I'd like to take you through the development process and explain some of the challenges we faced. CYBEX first contacted existing domestic and international customers and asked them what features they wanted most in a testing and rehabilitation system. We then looked at the competition and evaluated the strength and weaknesses of their systems. We interviewed hundreds of physical therapists and physicians and analyzed all the practical and clinical feedback we received. The result of all this research?
That's why we're here today.
Are you ready, Tom?
Ready.
I'd like you all to meet Norm, the new isokinetic testing and rehabilitation system from CYBEX.
NORM stands for Normative Outcomes for Rehabilitation Management.
Normative outcomes, because for the first time, you'll be able to access an isokinetic normative database of over 30,000 healthy individuals.
And instantly compare your patient's test results.
NORM produces objective documentation based on this comparison, which you can send to physicians and insurance companies. Why don't you come up for a closer look? The database is great for pre-placement physical capacity evaluations and return-to-work evaluations. The isokinetic database is constantly being added to and is the largest of its kind.
It's a tremendous new area for growth.
I like the modular design. What modes of operation are available with NORM?
NORM has CPM, active assist, multiple angle isometrics, isokinetics, and concentric eccentric. All modes have automated protocol features as well as sequential programming capability.
All right, let me show you something else. Excuse me. Take a look at the seat adjustments. The Easy Glide positioning system makes patient setups a breeze. Everything is accessible from both sides of the chair. And the corresponding scales on the dynamometer and the chair ensure exact seat position every time you set up a patient. For added safety, we've also included adjustable range of motion mechanical backup stops.
All patient information, including anatomical zero and range of motion, is stored and retrieved using Windows-based software.
That's right. And we specifically asked our focus groups about input devices, touch screens versus a mouse or keyboard. Their preference? The light pen. Our test results revealed it to be the most reliable and accurate.
Oh, and look at this. The computer is in front of the dynamometer. All the connections are readily accessible, and all the wires are hidden.
Exactly. And the monitor stand is adjustable for the left or right side to accommodate the therapist. Everything about NORM is designed to minimize the clinician's movement during patient setup and increase productivity.
My facility is pretty tight for space. What is NORM's footprint?
Only 28 square feet. This entire system will fit into almost any size facility.
How about the price? The system is competitively priced and can be purchased through the CYBEX leasing program. To answer your question, NORM is affordable for any practice.
But what about the setup patterns?
NORM has a total of 23 patient setup patterns.
Well, in my practice, I mostly see patients with sports-related injuries.
All right, suppose you're dealing with an anterior cruciate reconstruction, and you've chosen the knee extension flexion seated pattern for your patient. Based on the injury and your patient's progress, you'd make a decision on operating mode and protocol. For example, in CPM mode, you can set either the total amount of repetitions or length of time you want the patient to rehab for, and then set the appropriate foot-pound resistance. An important safety feature of NORM is the automatic cutoff. If a patient exceeds the torque programmed, all resistance is automatically released.
And the patient always has access to the comfort switch, which allows them to stop the system at any time.
How many knee patterns are there?
There are 3 knee patterns: extension flexion seated, extension flexion prone, tibial internal external rotation.
The majority of my patients are geriatric, and many of them require total joint replacement therapy. How does NORM handle those setup patterns?
NORM is excellent for all joint replacement therapy. Geriatric patients are especially comfortable on the NORM system, and the on-screen graphics help to motivate them.
What about hip patterns? We see a lot of those.
NORM has 3 hip setups: abduction adduction, flexion extension, internal external rotation. Regardless of the pattern, whether hip, knee, ankle, or wrist, the NORM system is designed to accommodate the ever-increasing geriatric population. In fact, we've found that patients are actually progressing faster on the NORM system.
Now, Patrick mentioned that he handles a lot of sports-related injuries.
Well then, I'm sure quick shoulder setup patterns are of interest to you. Patient positioning, data retrieval, and adapter placement make all of NORM's 9 shoulder patterns extremely efficient and comfortable for the patient. Based on independent research, the NORM system effectively rehabs the patients in less time using isokinetics than any other form of exercise.
I can vouch for that. I've used CYBEX isokinetic equipment for years.
Then the NORM system will be a welcomed addition to your facility.
Well, folks, why doesn't everybody take your seat, and perhaps we can answer any further questions you might have about our new friend, NORM.
Are the test exercise patterns we've seen included in the price of the system?
Yes, all setup patterns come standard on NORM.
Yeah, I'm curious. What about the CYBEX TEF modular component? Can it be used with NORM?
Absolutely. The TEF modular component is designed to adapt to the NORM system and can be installed on the left or right side of the system.
Pretty impressive system, wouldn't you agree?
Certainly looks easy to use.
Having instant access to a normative database will definitely have a positive impact on my practice.
With a small facility, the footprint is good for me.
I can see that my staff will be up and running on the Windows software in no time.
It's great having the entire user manual right on the help screen.
Well, we promised you a new concept in testing and rehabilitation. NORM is the most radical improvement in a testing and rehabilitation system that's ever been introduced.
And it's from CYBEX.